The emergency department doors slid open with a soft whoosh. Sarah Martinez looked up from her computer station, where she had been updating patient charts. It was just past 7 in the evening and the ER was busy as usual. The waiting room was full of people with various problems. Some held ice packs to their heads, others coughed into tissues. A mother rocked a crying baby in her arms. Sarah had been a nurse at St. Mary's Hospital for 8 years. She loved her job even on the hardest days. She loved helping people when they needed it most. She loved the fast pace of the emergency room. Every day brought something different. Every patient had a story. Tonight, Sarah was assigned to triage. This meant she was the first nurse to see new patients. She checked their vital signs and decided who needed to be seen first. It was an important job. Sometimes it meant the difference between life and death. A man walked through the doors, moving slowly. He was holding his chest with one hand. His other hand gripped the arm of a younger woman who looked worried. Sarah stood up immediately. Chest pain was always serious. It could not wait. "Hi, I'm Sarah. I'm a nurse here. Let's get you checked in right away," she said in a calm voice. She had learned over the years that staying calm helped patients feel less scared. The man nodded. His face showed pain, but he tried to smile. "Thank you," he said quietly. His voice was a bit shaky. "I'm Marcus Thompson. This is my daughter, Lisa." Sarah guided them to a triage room quickly. "Mr. Thompson, can you tell me what's happening?" "When did the pain start?" Marcus sat down slowly in the chair. He took a breath and spoke clearly, even though Sarah could see he was uncomfortable. "The pain started about 2 hours ago. At first I thought it was just heartburn, but it's gotten worse. It's a pressure in my chest like something heavy is sitting on it. The pain goes up into my jaw and down my left arm." Sarah's trained mind immediately noted these details. Pressure in the chest, pain in the jaw and left arm. These were classic signs of a heart problem. She wrapped a blood pressure cuff around his arm and placed a finger monitor on his hand to check his oxygen level. "Do you have any medical history I should know about?" Sarah asked as she watched the numbers on the monitor. "I have high blood pressure," Marcus said. "I take medication for it every day. And my father died of a heart attack when he was 50. My older brother had a heart attack 3 years ago. He survived, but he had to have surgery." Sarah wrote everything down quickly. Family history of heart disease was very important. His blood pressure reading appeared on the screen. It was high, 160/95. His heart rate was also elevated at 110 beats per minute. "Mr. Thompson, I'm going to take you back to a room right now. We need to do some tests. This could be serious and we don't want to wait," Sarah explained. Lisa, his daughter, looked frightened. "Is my dad having a heart attack?" Sarah chose her words carefully. She did not want to scare them, but she needed to be honest. "We need to run tests to find out exactly what's happening. But you did the right thing by coming in. Chest pain always needs to be checked." She led them to room 7, one of the cardiac rooms equipped with heart monitoring equipment. She helped Marcus onto the bed and immediately began attaching EKG leads to his chest. The machine would record his heart's electrical activity and show if there were any problems. "Mr. Thompson, have you ever had chest pain like this before?" Sarah asked as she worked. "No, never like this," Marcus replied. "I've had some heartburn over the years, but this is different. This really hurts." Sarah noticed that despite his pain, Marcus spoke well. He described his symptoms clearly. He answered her questions thoughtfully. Many patients in pain had trouble communicating, but Marcus remained composed. "What do you do for work?" Sarah asked. She liked to talk to her patients about their lives. It helped them stay calm. It also helped her see them as real people, not just cases. "I'm a professor," Marcus said. A small smile crossed his face despite the pain. "I teach English literature at the university. I've been there for 15 years. I love teaching. The students keep me young." "That sounds wonderful," Sarah said warmly. "What kind of literature do you teach?" "Mostly American literature," Marcus answered. "Right now my classes are reading James Baldwin and Toni Morrison. We're having great discussions about their work." Sarah smiled. "My daughter read Beloved in high school. She couldn't put it down." The EKG machine beeped, indicating it had finished recording. Sarah looked at the printout carefully. Her smile faded. She saw changes in the ST segments, the parts of the EKG that showed how the heart muscle was working. These changes suggested that Marcus's heart was not getting enough oxygen. This was very concerning. "Mr. Thompson, I'm going to start an IV in your arm. We need to draw some blood to run tests. I'm also going to give you some aspirin to chew." It helps protect the heart, Sarah explained. Is it bad? Marcus asked. His eyes met hers. She could see the fear there, but also trust. The EKG shows some changes that we need to investigate, Sarah said honestly. I'm calling the cardiologist right now. That's the heart doctor. He needs to see you as soon as possible. Lisa grabbed her father's hand. Dad, you're going to be okay, she said, but her voice trembled. Sarah placed a gentle hand on Lisa's shoulder. You're in the right place. We're going to take good care of him. She stepped out of the room and walked quickly to the nurse's station. She picked up the phone and dialed the number for the on-call cardiologist. After 3 rings, someone answered. This is Dr. Whitmore, a gruff voice said. Sarah had worked with Dr. Richard Whitmore before. He was a skilled cardiologist, one of the best in the hospital. But he was not known for his warm personality. Many nurses found him difficult to work with. He was impatient and did not like to be questioned. Dr. Whitmore, this is Sarah Martinez in the ER. I have a 45-year-old male with chest pain. Classic cardiac symptoms, positive family history, and his EKG shows ST segment changes. He needs to be seen right away. There was a pause on the line. I'll be there in 10 minutes, Dr. Whitmore said and hung up without saying goodbye. Sarah returned to Marcus's room. She had started an IV and drawn blood for testing. She gave him aspirin and some nitroglycerin under his tongue to help with the chest pain. She also gave him oxygen through a small tube in his nose. The doctor is on his way, Sarah told Marcus and Lisa. How's the pain now? A little better, Marcus said. The medicine is helping. Sarah checked his vital signs again. His blood pressure was still high and his heart rate was still fast. These were warning signs that his heart was working too hard. Tell me more about your teaching, Sarah said, trying to distract him from his worry. What's your favorite book to teach? Marcus's face brightened a little. That's a hard question. But if I had to choose, I'd say Invisible Man by Ralph Ellison. It's such a powerful book about identity and being seen. Every time I teach it, students have new insights. That's what I love about literature. It always has something new to say. Sarah listened as Marcus talked. She could tell that teaching was his passion. He spoke with enthusiasm even while lying in a hospital bed with chest pain. She admired his strength. As they talked, Sarah heard footsteps in the hallway. Heavy, quick footsteps. Dr. Whitmore had arrived. Sarah took a deep breath. She hoped he would see what she saw in the EKG. She hoped he would take Marcus's symptoms seriously. She had no idea that the next few hours would test everything she believed in as a nurse. She had no idea she was about to face the hardest decision of her career. All she knew was that Marcus Thompson needed help, and she was determined to make sure he got it. Dr. Richard Whitmore walked into room 7 with quick, confident steps. He was a tall man in his early 60s with gray hair and sharp blue eyes. He wore an expensive suit under his white doctor's coat. He had been a cardiologist for over 30 years and had a strong reputation in the hospital. People said he was brilliant, but they also said he was difficult. Sarah stood up when he entered. Dr. Whitmore, this is Marcus Thompson. He came in with chest pain that started 2 hours ago. He describes it as pressure with radiation to the jaw and left arm. He has a family history of heart disease. His father died of a heart attack and his brother had one 3 years ago. Dr. Whitmore barely looked at Marcus. He picked up the chart from the end of the bed and flipped through it quickly. His eyes scanned the pages, but Sarah noticed he did not spend much time on the EKG results. Mr. Thompson, Dr. Whitmore said without looking up from the chart. Are you taking any medications? Yes, doctor, Marcus answered politely. I take medicine for high blood pressure. Lisinopril 20 milligrams once a day. I also take a statin for cholesterol. Do you smoke? Dr. Whitmore asked. He still had not made eye contact with Marcus. No, sir. I've never smoked. Do you drink alcohol? Occasionally. Maybe a glass of wine with dinner on weekends. Dr. Whitmore finally looked at Marcus, but his glance was quick and dismissive. He did not pick up his stethoscope to listen to Marcus's heart. He did not examine him at all. Sarah found this strange. Usually, doctors did a physical examination, especially with chest pain. Have you been under stress lately? Dr. Whitmore asked. Marcus looked confused by the question. No more than usual. I'm a teacher, so there's always some stress with grading and deadlines, but nothing unusual. What about your diet? Do you eat a lot of spicy foods? Dr. Whitmore continued. Sometimes, Marcus said. But I don't see what that has to do with my chest pain. Doctor, I really think something is wrong with my heart. The pain is different from anything I've felt before. And with my family history, Dr. Whitmore interrupted him. His voice was sharp and impatient. Mr. Thompson, I'm the doctor here. Let me do the thinking. You came in with chest pain, but not all chest pain is a heart attack. In fact, most chest pain is not cardiac related. Sarah felt uncomfortable. She glanced at Marcus and saw that his expression had changed. He looked hurt by the doctor's tone. But doctor, Marcus tried again. The pain goes down my arm. And my father. I've heard about your father. Dr. Whitmore cut him off again. Having a family member with heart disease doesn't mean you're having a heart attack right now. What you're describing sounds like anxiety or indigestion. Have you been eating late at night? Marcus's face showed his frustration. I'm trying to explain my symptoms to you. I'm not an anxious person. This is real pain. I teach at the university, and I understand my body. Something is wrong. Dr. Whitmore's expression hardened. Mr. Thompson, I've been a cardiologist for over 30 years. I think I know a heart attack when I see one. Your symptoms are not specific for cardiac issues. Sarah could not stay quiet anymore. Dr. Whitmore, his EKG does show some changes. The ST segments are elevated in the anterior leads. Dr. Whitmore turned to look at Sarah. His eyes were cold. Nurse Martinez, I've reviewed the EKG. Those changes are minimal and could be normal variants. Not everyone has a textbook EKG. But Sarah had looked at the EKG carefully. The changes were not minimal. They were concerning. She knew what a normal EKG looked like, and Marcus's was not normal. With all due respect, doctor, combined with his symptoms and family history, I think we should run more tests, Sarah said. She kept her voice professional, but inside her heart was beating fast. She knew that challenging a doctor was risky, especially a senior doctor like Dr. Whitmore. Dr. Whitmore stared at her for a moment. Then he turned back to Marcus. He spoke to Sarah, but he said it loud enough for Marcus to hear. His voice dripped with condescension. These uneducated people always think they're having heart attacks when it's just stress from their lifestyle choices, he said to Sarah, as if Marcus was not even in the room. They watch too much television and come running to the ER every time they have a little discomfort. The words hung in the air like poison. Sarah felt her face grow hot. She could not believe what she had just heard. She looked at Marcus and saw the shock and humiliation on his face. His daughter Lisa gasped. Doctor, Mr. Thompson is a university professor, Sarah said, trying to keep her voice steady. But regardless of anyone's education or background, we need to take chest pain seriously. Marcus spoke up, his voice tight with controlled anger and hurt. I have a PhD in English literature. I've published 2 books and over 20 academic articles. But even if I hadn't finished high school, my pain would still be real. High symptoms would still matter. Dr. Whitmore waved his hand dismissively. I'm not trying to insult anyone. I'm simply saying that people often misinterpret what their bodies are telling them. You're feeling anxiety, probably about work or personal issues, and it's manifesting as physical symptoms. It's very common. I know the difference between anxiety and a heart attack, Marcus said firmly. Please, doctor, I'm asking you to take this seriously. Do more tests. Make sure I'm okay. Dr. Whitmore sighed as if Marcus was being difficult. Fine, I'll order some blood work. But I'm confident this is not cardiac related. You're probably dealing with gastroesophageal reflux disease, what we call GERD. It's acid reflux, very common, causes chest pain, and people often confuse it with heart problems. Sarah could not believe what she was hearing. Everything about Marcus's presentation suggested a possible heart attack. The type of pain, the location, the radiation to his arm and jaw, the family history, the elevated blood pressure and heart rate, and the EKG changes. How could Dr. Whitmore dismiss all of this? What blood work are you ordering? Sarah asked. Basic metabolic panel and a CBC, Dr. Whitmore said. That's a complete blood count. Sarah knew these tests would not tell them if Marcus was having a heart attack. They needed to order cardiac enzymes, specifically troponin levels. Troponin was a protein released when the heart muscle was damaged. It was the gold standard test for detecting a heart attack. Should we also order troponin levels? Sarah suggested carefully. Dr. Whitmore looked annoyed. That's not necessary. I don't want to waste hospital resources on unnecessary tests. We already have an EKG. If I thought this was cardiac, I would order the troponin, but it's not. Lisa spoke up for the first time since the doctor arrived. Please, doctor. My dad is telling you something is wrong. Can't you just do the test to be sure? What's the harm in checking? Dr. Whitmore turned to her with an expression that made it clear he did not appreciate being questioned. Young lady, medical decisions are made by doctors, not by families. I understand you're worried about your father, but trust me, he's fine. He doesn't need cardiac enzymes. Sarah felt anger building inside her. This was wrong. Everything about this situation was wrong. Dr. Whitmore had spent less than 5 minutes with Marcus. He had not examined him. He had dismissed his symptoms based on assumptions. And worse, he had made a racist comment that showed his judgment was clouded by bias. She thought about the oath she had taken as a nurse. She had promised to be a patient advocate. She had promised to put patient safety first, always. She looked at Marcus, who sat on the bed looking defeated and scared. She looked at Lisa, whose eyes were filled with tears. Sarah made a decision. Her hands were shaking slightly, but her voice was steady when she spoke. Dr. Whitmore, I'm documenting in the chart that I believe cardiac enzymes should be ordered. I'm also noting that the patient has presented with classic signs of acute coronary syndrome, and that his EKG shows ST segment elevation. As the attending nurse, I'm formally recommending that troponin levels be checked and that a cardiology consult be completed. The room went silent. Dr. Whitmore's face turned red. Sarah had just challenged him directly, and she had done it in front of the patient. She had also created a paper trail, documentation that would show she disagreed with his assessment. Nurse Martinez, Dr. Whitmore said slowly, his voice low and dangerous. Are you seriously questioning my medical judgment? I'm advocating for my patient, Sarah replied. Her heart was pounding, but she stood her ground. That's my job. Dr. Whitmore took a step closer to her. Your job is to follow doctor's orders, not to make medical diagnoses. You are a nurse, not a physician. Do you understand the difference? I understand perfectly, Sarah said. I also understand that nurses are trained to recognize warning signs and to speak up when we have concerns. I have concerns about this patient. Other staff members had started to gather outside the room. They could hear the raised voices. A young resident peeked through the door, looking worried. Another nurse, Maria, who was Sarah's friend, stood in the hallway watching with wide eyes. Dr. Whitmore looked around and realized they had an audience. His face was still red, but he seemed to regain some control. He straightened his tie and picked up the chart. Fine, he said through clenched teeth. I'll order your precious troponin test. But when it comes back normal, and it will come back normal, we're going to have a conversation about your behavior tonight. You're overstepping, Nurse Martinez. You're practicing medicine without a license, and that's a serious problem. After Dr. Whitmore left the room, Sarah stood still for a moment. She could feel her heart beating fast in her chest. Her hands were still trembling. She had just done something that could cost her everything. She had challenged a senior doctor in front of a patient. She had created official documentation that questioned his judgment. In the hospital hierarchy, nurses were not supposed to do that. But when she looked at Marcus Thompson lying in the hospital bed, when she saw the gratitude in his eyes and the relief on his daughter's face, Sarah knew she could not have done anything different. She had become a nurse to help people. She had taken an oath. Sometimes keeping that oath meant taking risks. Are you going to be okay? Marcus asked her. His voice was filled with concern, not for himself, but for her. Even in his own pain and fear, he was worried about what his situation might cost her. Sarah managed a small smile. Don't worry about me, Mr. Thompson. Let's focus on getting you better. That's what matters right now. She busied herself checking his vital signs again. His blood pressure was still elevated at 158/92. His heart rate had come down slightly to 95 beats per minute, probably because of the nitroglycerin she had given him. But he was not out of danger yet. How's your pain now? Sarah asked. It's still there, Marcus admitted. Maybe a 6 out of 10. It was an 8 before. The medicine you gave me helped some, but it hasn't gone away. Sarah made a note on his chart. Continuing chest pain was another red flag. If this was just anxiety or acid reflux like Dr. Whitmore claimed, the nitroglycerin should have made the pain go away completely. The fact that Marcus still had pain suggested something more serious was happening. Lisa sat in the chair next to her father's bed, holding his hand. She looked young, maybe in her mid-20s. Her eyes were red from crying. Is my dad really going to be okay? She asked Sarah in a whisper. Sarah pulled up a chair and sat down beside her. She spoke honestly but gently. I believe your dad needs more tests. The blood test that was ordered will help us know more, but I want you to know that I'm watching him closely. I won't let anything happen to him." "That doctor didn't believe him," Lisa said, anger mixed with her fear. "He didn't even examine my dad. He just decided it wasn't serious without really checking." Sarah chose her words carefully. She could not badmouth another medical professional, even though she agreed with Lisa. Sometimes doctors and nurses see things differently. That's why we work as a team. Different perspectives can help us give better care. Marcus squeezed his daughter's hand. Sarah stood up for me. That took courage. Not many people would have done that. Before Sarah could respond, Maria, her friend and fellow nurse, appeared at the door. Maria was a few years older than Sarah, with kind brown eyes and short curly hair. They had worked together for 5 years and had become close friends. "Sarah, can I talk to you for a minute?" Maria asked. Sarah stepped out into the hallway with her. The emergency department was still busy around them. Phones rang. Monitors beeped. Other nurses rushed past with medications and supplies, but Maria pulled Sarah to a quiet corner. "Everyone's talking about what just happened," Maria said in a low voice. "Dr. Whitmore is furious. He's in the doctor's lounge telling anyone who will listen that you were insubordinate and that you don't know your place." Sarah felt her stomach drop. She had expected this, but hearing it confirmed still hurt. "I couldn't just stand there, Maria. That man is having a heart attack, I know it. And Dr. Whitmore dismissed him without even doing a proper exam." "I believe you," Maria said quickly. "I saw the EKG. I agree with your assessment. But Sarah, you know how this hospital works. Dr. Whitmore has been here for decades. He has powerful friends. The administration always sides with the doctors over the nurses. So what should I do? Just let a patient die because I'm afraid of making waves?" Sarah's voice rose slightly and she forced herself to speak more quietly. "I became a nurse to save lives, not to protect doctors' egos." Maria put a hand on her arm. "I'm not saying you were wrong. I'm saying you need to be careful. Document everything. Make sure you have a paper trail, and maybe call the nursing supervisor. Let her know what's happening before Dr. Whitmore goes to administration." Sarah nodded. Maria was right. She needed to protect herself while also protecting her patient. "Will you help me? Can you be a witness to what happened?" "Of course," Maria said without hesitation. "I heard everything. I saw how he treated Mr. Thompson, and I saw that he didn't do a physical exam. I'll back you up." Sarah felt a rush of gratitude. In moments like this, she understood the importance of having good colleagues who stood by each other. "Thank you. That means everything to me." She returned to Marcus's room. While she had been gone, a phlebotomist had come to draw his blood for the tests. Sarah checked the orders in the computer. Dr. Whitmore had ordered the basic tests he mentioned, but he had also, reluctantly, added the troponin test. At least he had done that much. "The blood work has been sent to the lab," Sarah told Marcus. "It usually takes about 45 minutes to get results. I'm going to stay close by. If you need anything at all, you press this button and I'll be here right away." "You've already done so much," Marcus said. "I don't know how to thank you." "You don't need to thank me," Sarah replied. "I'm just doing my job." But even as she said it, she knew it was not entirely true. What she had done went beyond just doing her job. She had put her career on the line for a patient she had only known for an hour. She had challenged authority and broken unwritten rules. She had done what felt right, even when it was hard. As Sarah worked on her other patients over the next hour, she kept thinking about Marcus. She checked on him every 10 minutes, looking at his monitors, asking about his pain, making sure he was stable. Each time she entered his room, she felt both relief that he was still okay and anxiety about what the blood tests would show. Dr. Whitmore avoided her. When she saw him in the hallway, he turned and walked in the other direction. Other doctors she passed gave her strange looks. Word had spread quickly through the hospital about what had happened. Sarah felt like everyone was watching her, judging her. Some of her fellow nurses were supportive. They whispered encouragement when they passed her in the hallway. They gave her thumbs-up signs when no one was looking. But others seemed disapproving. They thought she'd crossed a line. They worried that her actions would make life harder for all nurses. Sarah tried to ignore all of it and focus on her work. She had 3 other patients besides Marcus: an elderly woman with pneumonia, a teenager with a broken arm from skateboarding, a man with kidney stones. She gave them all the same careful attention she gave to every patient. but her mind kept drifting back to room 7. Finally, after what felt like forever, the computer system beeped. New lab results were available. Sarah's heart jumped. She clicked on Marcus Thompson's chart and pulled up the test results. Her breath caught in her throat. The troponin level was elevated. Not just slightly elevated, but significantly elevated. The normal range was less than 0.04. Marcus's level was 2.8. This was definitive proof. Marcus Thompson was having a heart attack. Sarah felt a mix of emotions. Vindication, because she had been right. Fear, because this confirmed that Marcus was in serious danger. And anger, because Dr. Whitmore had almost sent this man home to die. She printed out the results and walked quickly to find Dr. Whitmore. She found him at the nurse's station, writing notes on a chart. Her hands were shaking as she approached him, but her voice was steady. Dr. Whitmore, Mr. Thompson's troponin results are back. They're significantly elevated at 2.8. He needs immediate intervention. Dr. Whitmore looked up from his chart. For a moment his face showed surprise. Then his expression became defensive. "Let me see that," he said, grabbing the paper from her hand. He stared at the results. Sarah watched his face carefully. She saw the moment when he realized she had been right and he had been wrong. But instead of admitting his mistake, instead of immediately helping Marcus, he became angry. "This doesn't necessarily mean anything," he said, but his voice lacked conviction. "Troponin can be elevated for many reasons. It could be a lab error." Sarah could not believe what she was hearing. "Dr. Whitmore, you know that's not true." Combined with his EKG changes and his symptoms, this is clear evidence of acute myocardial infarction. He needs to go to the cardiac catheterization lab right now. Every minute we wait, more heart muscle dies. Several other medical staff members had stopped what they were doing. They were listening to this conversation. A young resident stepped forward. "Dr. Whitmore, I agree with the nurse," the resident said nervously. "These results indicate STEMI. We should activate the cath lab team immediately." Dr. Whitmore looked around at all the faces watching him. He was trapped. He could not ignore these results, not with witnesses present. But Sarah could see that he was furious at being proven wrong, especially by a nurse. "Fine," he said coldly. "Page cardiology. Tell them we have a possible MI that needs evaluation." "Not possible," Sarah said firmly. "Definite. And not evaluation. Immediate intervention." Dr. Whitmore's face turned red again. "Do not tell me how to manage my patients, Nurse Martinez." "He's not just your patient," Sarah replied. "He's a human being whose life is in danger. And right now, protecting his life is more important than protecting anyone's pride." The hallway went completely silent. No one could believe that Sarah had just said that to a senior doctor. Maria, who was standing nearby, looked shocked but also impressed. The young resident's eyes were wide. Dr. Whitmore stared at Sarah for a long moment. She stared back, refusing to look away. Finally, he turned to the resident. "Page Dr. Patel from Interventional Cardiology," he said through clenched teeth. "Tell him we have a STEMI that needs immediate cath." Then he walked away without another word. Sarah let out a breath she did not know she had been holding. Her whole body was shaking now. She had just fought with a doctor twice in one night. She had probably ended her career at this hospital. But Marcus Thompson was going to get the treatment he needed. That was all that mattered. She walked back to room 7 to tell Marcus the news. When she entered, he looked at her with worried eyes. "The blood test showed that you are having a heart attack," Sarah told him gently. "We're getting you to the cardiac catheterization lab right away. They're going to do a procedure to open up the blocked artery in your heart." Marcus's face went pale. "A heart attack," he whispered. "I was right." "Yes, you were," Sarah said. "And because we caught it now, we can treat it." "You're going to be okay." Lisa started crying. Marcus reached for his daughter's hand. "You saved my life," he said to Sarah. "If you hadn't pushed for that test, if you hadn't stood up to that doctor, I could have died." Sarah felt tears in her own eyes, but she blinked them back. "You're not going to die. Not on my watch." Within minutes, the cardiology team arrived. They surrounded Marcus's bed, preparing to transfer him to the cardiac lab. Sarah gave them a detailed report of everything that had happened. Every symptom, every test result. They thanked her for her thorough care and her advocacy. As they wheeled Marcus out of the room, he reached for Sarah's hand. "Thank you," he said one more time. "Thank you for seeing me, for believing me, for fighting for me." Sarah squeezed his hand. "That's what nurses do. We fight for our patients, always." As she watched them wheel Marcus away, Sarah felt exhausted. The adrenaline that had kept her going was fading. She sat down at the nurse's station and put her head in her hands. She had done it. She had saved a life. But she knew the hardest part was still to come. She had made a powerful enemy, and now she had to face the consequences of her choices. Sarah sat at the nurse's station trying to focus on her paperwork. Her hands had finally stopped shaking, but her mind was racing. Marcus Thompson had been rushed to the cardiac catheterization lab 20 minutes ago. The interventional cardiology team was working on him now. All Sarah could do was wait and hope that they had caught the heart attack in time. Around her, the emergency department continued its usual chaos. Ambulances arrived with new patients. Families asked questions at the front desk. Monitors beeped their constant rhythms. But Sarah felt separated from all of it, as if she was watching everything through a thick glass window. Maria came and sat beside her. "How are you holding up?" she asked quietly. "I don't know," Sarah admitted. "I keep thinking about what could have happened. If I hadn't pushed for that troponin test, if I had just followed Dr. Whitmore's orders, Marcus would have been sent home. He would have died." "But you did push," Maria reminded her. "You saved his life. Remember that." Before Sarah could respond, she saw Dr. Whitmore walking toward the nurse's station. Her stomach tightened. He looked angry, his jaw set in a hard line. She braced herself for another confrontation, but Dr. Whitmore walked right past her without saying a word. He went into the doctor's lounge and slammed the door behind him. Sarah let out a breath she had been holding. "He's embarrassed," Maria observed. "He was wrong, and now everyone knows it. His ego can't handle that." "I don't care about his ego," Sarah said. "I just care that Marcus gets the help he needs." An hour passed slowly. Sarah tried to focus on her other patients, but her attention kept drifting. She checked her phone repeatedly, hoping for an update from the cardiac team. Finally, her phone buzzed with a call from an internal hospital number. "This is Sarah," she answered quickly. "Sarah, it's Dr. Patel from Interventional Cardiology." His voice was calm and professional. "I wanted to update you on Marcus Thompson." Sarah's heart pounded. "How is he?" "He's going to be fine," Dr. Patel said, and Sarah felt relief wash over her like a wave. "You were absolutely right to push for those cardiac enzymes. He had a 90% blockage in his left anterior descending artery. That's the main artery that supplies blood to the front of the heart. We call it the widowmaker because it's so dangerous." Sarah closed her eyes. 90% blocked. Marcus had been minutes away from a massive, possibly fatal heart attack. "We placed a stent to open up the artery," Dr. Patel continued. "The procedure went well. Blood flow is restored. He's stable now and heading to the cardiac intensive care unit for monitoring." "Thank God," Sarah whispered. "Thank you, Dr. Patel." "No, thank you," the cardiologist said. "If you hadn't insisted on those tests, if you hadn't advocated for your patient, we wouldn't have caught this in time. You saved his life, Sarah. I've reviewed his chart and the whole situation. What you did tonight took real courage." After she hung up, Sarah put her head down on the desk. Tears finally came, tears of relief and exhaustion and overwhelming emotion. Maria put an arm around her shoulders and let her cry. "He's okay," Sarah said through her tears. "He's going to be okay. Because of you," Maria said firmly. "Don't ever forget that." The rest of Sarah's shift passed in a blur. She took care of her patients, completed her charting, and tried to process everything that had happened. When her shift finally ended at midnight, she was exhausted. But before she went home, there was something she needed to do. She took the elevator up to the cardiac intensive care unit on the 4th floor. The CICU was quiet at this late hour. Most of the patients were sleeping. Soft monitors beeped. Nurses moved quietly from room to room. Sarah found Marcus's room. Through the window, she could see him lying in bed. He was awake, and Lisa was sitting in a chair beside him. They were holding hands and talking quietly. Several monitors tracked his heart rhythm and vital signs. An IV dripped medication into his arm. But he was alive. He was going to be okay. Sarah knocked softly on the door and entered. Marcus's face lit up when he saw her. "Sarah," he said, his voice tired but warm. "They told me you saved my life." "The cardiologist saved your life," Sarah said. "I just made sure you got to them." "No," Marcus insisted. "You did more than that. You believed me when the doctor didn't. You stood up for me when it could have cost you your job. You fought for me." Lisa stood up and gave Sarah a tight hug. "Thank you," she whispered. "Thank you for not giving up on my dad." Sarah hugged her back. How are you feeling, Mr. Thompson? Call me Marcus, he said with a small smile. Anyone who saves my life gets to use my first name. And I feel good, actually. Tired, but good. Better than I've felt in hours. The chest pain is gone. That's because the blood is flowing to your heart again, Sarah explained. The stent opened up the blocked artery. Your heart muscle is getting the oxygen it needs now. Marcus looked at her seriously. The doctor who did the procedure, Dr. Patel, he told me I had a 90% blockage. He said if I had gone home tonight, I probably would have died. Sarah nodded. She could not sugarcoat the truth. Yes, you were in serious danger. But Dr. Whitmore wanted to send me home, Marcus said quietly. He told me it was just anxiety. He didn't even examine me. I know, Sarah said, and that was wrong. It should never have happened. It happened because of how he saw me, Marcus said. His voice was sad but clear. I'm a black man. He looked at me and made assumptions. He called me uneducated. He decided I didn't know my own body. He didn't take me seriously. Sarah sat down in the empty chair on the other side of his bed. What he said to you was racist and unacceptable. The way he treated you was unacceptable. You deserved better care than that. A lot of black people have experiences like this in hospitals, Marcus said. We tell doctors we're in pain and they don't believe us. We explain our symptoms and they dismiss us. The statistics are clear. Black patients receive worse care than white patients even when we have the same conditions. Lisa spoke up. My grandfather died of a heart attack. They sent him home from the emergency room 3 times before the final heart attack that killed him. Each time the doctor said it was just indigestion or stress. They never did the right tests. Sarah felt anger and sadness mixing together. I'm so sorry. That should never happen. Every patient deserves to be heard, believed, and treated with respect. Most patients don't have a nurse like you fighting for them, Marcus said. What happens to them? It was a question Sarah had been thinking about all night. How many patients had been dismissed by Dr. Whitmore? How many had gone home when they should have been admitted? How many had suffered or died because of bias and prejudice in their care? I don't know, Sarah admitted. But what happened tonight cannot be ignored. This has to be reported. Dr. Whitmore needs to be held accountable. Will you report him? Marcus asked. Sarah took a deep breath. Yes, I'm going to file a formal complaint. It's going to be difficult. He's a powerful doctor with a lot of friends in this hospital. But what he did was wrong on every level. He provided substandard care and he made a racist comment. Both of those things are serious violations. I'll support you, Marcus said immediately. I'll file a complaint too. I'll testify to what happened. I'm not going to stay quiet about this. Are you sure? Sarah asked. It could get complicated. There might be an investigation. You just had a heart attack. You need to focus on recovery. Marcus shook his head. I'm a black man who almost died because a doctor didn't take me seriously. I'm a professor who teaches students to speak up against injustice. How can I stay silent when I have a chance to make things better? Not just for me, but for the next black patient who comes into that emergency room. Sarah felt her respect for Marcus grow even deeper, even after everything he had been through. Even lying in a hospital bed recovering from a heart attack, he was thinking about others. Then we'll do this together, Sarah said. I'll document everything that happened. Every detail. Every word that was said. And I'll submit it to the hospital's ethics board and to nursing administration. Lisa pulled out her phone. I recorded some of it, she said quietly. When Dr. Whitmore was being dismissive to my dad, I started recording on my phone. I didn't know what else to do. I was scared and angry, and I thought we might need proof of how we were treated. Sarah's eyes widened. You recorded it? Just the audio, Lisa said. Is that legal? I don't want to get in trouble. In this state, only one party needs to consent to recording a conversation, Sarah said. You were part of the conversation, so yes, it's legal. And it could be very important evidence. Marcus looked at his daughter with pride and surprise. You recorded it? I didn't even notice. I had to do something, Lisa said. I felt so helpless watching him treat you that way. At least this way, there's proof. He can't deny what he said. The 3 of them sat in silence for a moment, processing the significance of this. With Lisa's recording and Sarah's documentation, they had solid evidence of what had happened. Dr. Whitmore could not claim he was misquoted or misunderstood. The truth was captured. This is going to be hard, Sarah warned them. The hospital might try to protect Dr. Whitmore. They might pressure us to drop the complaint. They might make our lives difficult. I don't care, Marcus said firmly. This is bigger than just what happened to me tonight. This is about every patient who doesn't get believed. Every person of color who receives substandard care. Every time bias affects medical treatment. We have to speak up, Sarah nodded. You're right. And I promise you, I won't back down. No matter what happens, I'll see this through. A nurse from the CICU came to the door. I'm sorry, but visiting hours are over. Mr. Thompson needs to rest. Sarah stood up. I should let you sleep. You've had a long night. Marcus reached for her hand. Sarah, I meant what I said. You saved my life tonight. Not just physically, but in another way too. You saw me as a person. You listened to me. You believed me. In that moment when Dr. Whitmore was dismissing me and degrading me, you stood up and said my life mattered. I'll never forget that. Sarah squeezed his hand. Tears threatened to come again, but she blinked them back. Your life does matter. Every patient's life matters. That's why I became a nurse, and that's why I'll keep fighting for what's right. As Sarah left the hospital that night and walked to her car, she felt changed. The events of the past few hours had tested her in ways she had never been tested before. She had stood up to power. She had risked her career. She had chosen her patient over her own safety, and she would do it again in a heartbeat. She drove home through the quiet streets, her mind still processing everything. When she finally got to her apartment, she sat down at her kitchen table and opened her laptop. While everything was still fresh in her mind, she began to write. She documented every detail of Marcus's case, every symptom he reported, every test result, every word Dr. Whitmore said, every action she took. She wrote for 2 hours, making sure nothing was left out. This report would be her evidence. This would be how she held Dr. Whitmore accountable. When she finally finished and saved the document, Sarah looked at the clock. It was almost 3 a.m. She had to be back at work in 12 hours. But first, she needed to sleep. Tomorrow would bring new challenges. Tomorrow she would submit her complaint and face whatever consequences came. But tonight Marcus Thompson was alive. Tonight she had made a difference. Tonight she had honored her oath as a nurse, and that was enough. Sarah woke up after only 4 hours of sleep. Her alarm had not gone off yet, but she could not sleep anymore. Her mind was too full of everything that had happened. She lay in bed staring at the ceiling, thinking about the day ahead. Today, she would submit her formal complaint about Dr. Whitmore. Today, everything would change. She got up, made coffee, and sat at her kitchen table with her laptop. She read through the report she had written the night before, making small corrections and adding a few more details she had remembered. When she was satisfied that it was complete and accurate, she attached it to an email. The email would go to 3 people. First, to Margaret Chen, her nursing supervisor. Second, to the hospital's ethics board. And third, to the patient advocacy office. Sarah wanted to make sure that multiple people in authority knew what had happened. She did not want this to be buried or ignored. Her finger hovered over the send button. Once she pressed it, there would be no going back. This would officially become a complaint against Dr. Richard Whitmore, one of the most senior and respected doctors at St. Mary's Hospital. Sarah thought about Marcus Thompson lying in the cardiac intensive care unit. She thought about his daughter, Lisa, who had stayed up all night worried about her father. She thought about all the other patients who might have been dismissed and sent home by Dr. Whitmore. She thought about the racist comment he had made, the way he had treated Marcus as if his life did not matter. She pressed send. The email was gone. It was done. Sarah got dressed for work and drove to the hospital. When she walked through the doors of the emergency department, she immediately felt that something was different. People looked at her strangely. Conversations stopped when she walked by. Nurses who usually greeted her warmly looked away. Maria pulled her aside before she could clock in.
Sarah, be careful today. Dr. Whitmore knows you're going to file a complaint.
Someone must have warned him. He's been here since early this morning talking to administrators. Sarah's heart sank. How does he know already? Hospitals are like small towns, Maria said. Word spreads fast. He's doing damage control, trying to get ahead of your complaint. What's he saying? Maria looked uncomfortable. He's telling people that you were insubordinate, that you overstepped your role as a nurse, that you embarrassed him in front of a patient. He's making you sound like the problem. Sarah felt anger rising in her chest. That's not what happened. He's twisting the truth. I know, Maria said. But he has a lot of power in this hospital. A lot of people are going to believe his version. Before Sarah could respond, her supervisor, Margaret Chen, appeared. Margaret was a woman in her 50s with gray hair pulled back in a tight bun. She had been a nurse for 30 years and had been Sarah's supervisor for the past 5 years. Usually she was fair and supportive. But today her face was serious and hard to read. "Sarah, I need you to come to my office," Margaret said. Her voice was formal, not warm like usual. Sarah followed her supervisor to the small office at the end of the hallway. Margaret closed the door behind them and sat down at her desk. She did not invite Sarah to sit. "I received your email this morning," Margaret said. "It contains very serious allegations against Dr. Whitmore." "Yes," Sarah said. "Everything in that report is true. I documented it all carefully." Margaret sighed. She looked tired. "Sarah, do you understand what you're doing? You're accusing one of our most senior physicians of racism and medical negligence. These are career-ending accusations." "They're not accusations," Sarah said firmly. "They're facts. Dr. Whitmore called Marcus Thompson uneducated based on his race. He dismissed his symptoms without doing a proper examination. He refused to order necessary tests. If I hadn't pushed back, that patient would have died." "The patient's daughter has a recording," Margaret said. "I've been informed of this. Is it true that she recorded the interaction?" "Yes, she was scared and wanted evidence of how they were being treated." Margaret leaned back in her chair. "This recording changes things. It means we can't just dismiss this quietly. If this becomes public, it could be very damaging to the hospital." Sarah felt her anger grow stronger. "Is that what you're worried about? The hospital's reputation? What about Marcus Thompson's life? What about all the other patients who might be at risk?" "Don't take that tone with me," Margaret snapped. "I'm on your side, Sarah, but you need to understand the reality of the situation. Dr. Whitmore is claiming that you were the one who acted inappropriately. He says you questioned his medical judgment in front of a patient, which undermined his authority and violated protocol." "I advocated for my patient," Sarah said. "That's my job as a nurse." "There are proper channels for expressing concerns," Margaret said. "You could have pulled him aside privately. You could have asked for a second opinion from another doctor. Instead, you challenged him directly in front of the patient and created a scene." Sarah could not believe what she was hearing. "Margaret, are you seriously suggesting I should have been more worried about his feelings than about my patient's life?" Marcus Thompson had a 90% blockage in his left anterior descending artery. He was dying. There was no time for proper channels or private conversations. Margaret rubbed her temples. "I know, Sarah, I know you saved that patient's life. Everyone knows it. Dr. Patel has been very clear about that in his notes. But the way you did it has created a problem. You've made a powerful enemy, and now there's going to be an investigation." "Good," Sarah said. "There should be an investigation. What Dr. Whitmore did was wrong." "The investigation will look at both of your actions," Margaret warned. "Not just his. They'll examine whether you followed proper protocol, whether you were insubordinate, whether you acted within your scope of practice as a nurse." Sarah felt fear creep in for the first time. "Are you saying I could lose my job?" Margaret looked at her with something like pity. "I'm saying this is going to be difficult. The hospital administration is not happy. They're worried about a lawsuit. They're worried about bad publicity. Some of them are pushing to make this go away quietly." "By making me go away?" Sarah asked. "By convincing you to drop the complaint," Margaret said. "They want me to talk to you about reconsidering. They're suggesting that maybe there was a misunderstanding. Maybe emotions were running high. Maybe everyone can move forward and learn from this experience." "You mean cover it up," Sarah said flatly. "I mean resolve it without destroying careers," Margaret replied. "Yours or Dr. Whitmore's?" Sarah stood up straighter. "I'm not dropping the complaint. What happened was wrong. Marcus Thompson deserves justice, and other patients deserve to know that this hospital takes discrimination seriously." Margaret sighed again. "I was afraid you'd say that. Sarah, I admire your principles. I really do. But principles don't pay your bills. This fight could cost you everything." "Then that's what it costs," Sarah said. "I didn't become a nurse to stay quiet when patients are being harmed. I took an oath. So did Dr. Whitmore," Margaret pointed out. "And he's been practicing medicine for 30 years. He has a good reputation. People respect him. Your complaint is saying that he's a racist who provides substandard care. That's a very serious claim." "It's a true claim," Sarah insisted. "And I'm not the only one who's seen this pattern. Have you ever looked at Dr. Whitmore's interactions with minority patients? Have you ever noticed how he treats black patients differently than white patients? Margaret's expression shifted slightly. Sarah could see that she had hit a nerve. Other nurses have seen things too, Sarah continued. I've talked to them. They've witnessed similar behavior. But they were afraid to speak up because of exactly what's happening right now. Because the hospital protects doctors and punishes nurses who dare to question them. That's not fair, Margaret said. The hospital doesn't what? Sarah interrupted. Doesn't protect its powerful doctors? Then why are we having this conversation? Why are you trying to convince me to drop my complaint instead of supporting me? Margaret stood up. I am supporting you, Sarah. I'm trying to prepare you for what's coming. This is going to get ugly. Dr. Whitmore has already filed a counter-complaint against you. He's claiming professional misconduct. Sarah felt like she had been punched in the stomach. Professional misconduct? He says you were insubordinate, that you undermined his medical authority, that you were hostile and aggressive toward him. He's painting a picture of a nurse who thinks she knows better than doctors and who doesn't respect the medical hierarchy. That's a lie, Sarah said. I was protecting my patient. It's going to be your word against his, Margaret said. Unless other witnesses come forward to support you. Maria was there, Sarah said. She heard everything. She'll testify about what happened. One nurse's word against a senior physician's, Margaret said. It might not be enough, Sarah felt desperation rising. There's the recording. Lisa recorded part of the interaction. You said yourself that changes things. It helps, Margaret admitted. But recordings can be ambiguous. Lawyers can argue about context and interpretation, and the patient and his family are emotionally involved. Their testimony could be seen as biased. Sarah sat down in the chair, suddenly feeling exhausted. So what do I do? Margaret's expression softened. You find more witnesses. You document everything. You prepare for a fight. And you hope that truth wins out over politics. Over the next few days, Sarah did exactly that. During her breaks and after her shifts, she talked to other nurses. She asked them carefully if they had ever witnessed concerning behavior from Dr. Whitmore. At first, people were reluctant to talk. They were afraid. But slowly, as word spread about Sarah's complaint and about Marcus Thompson's near-death experience, nurses began to open up. Monica, a nurse who had worked in the emergency department for 12 years, told Sarah about a Hispanic woman who had come in with stroke symptoms. Dr. Whitmore had dismissed her symptoms as a migraine and sent her home. She had a massive stroke the next day. James, one of the few male nurses in the department, described an incident with an elderly black man who had come in with difficulty breathing. Dr. Whitmore had barely examined him before diagnosing anxiety and prescribing sedatives. The man had pneumonia and ended up on a ventilator for 2 weeks. Keisha, a young nurse who had only been at St. Mary's for 2 years, shared her experience with an Asian teenager who had severe abdominal pain. Dr. Whitmore had accused her of seeking drugs and sent her away. She had appendicitis and had to have emergency surgery that night at a different hospital. Each story made Sarah angrier and more determined. This was not just about Marcus Thompson. This was about a pattern of discrimination and poor care that had been going on for years. Why didn't anyone report this before? Sarah asked Keisha. Keisha looked down at her hands. Because we're scared. Nurses who complain about doctors get labeled as troublemakers. We get bad schedules. We get passed over for promotions. Sometimes we lose our jobs. It's easier to keep your head down and hope someone else speaks up. But people are getting hurt, Sarah said. Patients are dying. I know, Keisha said, her voice breaking. I think about that woman with appendicitis all the time. She was only 16. She was crying and begging Dr. Whitmore to help her. And he just dismissed her, called her dramatic. I wanted to say something, but I didn't. I was a new nurse. I thought maybe I was wrong. Maybe I didn't understand. But I wasn't wrong. She almost died. Sarah put a hand on Keisha's shoulder. It's not your fault. The system is designed to keep us quiet, but we can change that. We can speak up together. Are you sure? Keisha asked. Are you sure we won't just lose our jobs? I'm not sure of anything, Sarah admitted. But I know that staying silent means more people will get hurt. And I can't live with that. One by one, 3 other nurses agreed to come forward. They documented their experiences. They provided written statements. They agreed to testify if necessary. Marcus Thompson also filed his own formal complaint with the hospital. In it, he described in detail what had happened that night. He did not hold back. He wrote about Dr. Whitmore's racist comment about being dismissed and degraded, about the fear of not being believed. He wrote about Sarah's courage in standing up for him. Lisa provided the audio recording. On it, you could clearly hear Dr. Whitmore's condescending tone. You could hear him calling Marcus uneducated. You could hear Sarah's firm but professional responses. It was damning evidence. The hospital had no choice but to launch a full investigation. They hired an outside firm to review the case to make it look fair and unbiased. But Sarah knew the hospital was hoping to find a way to protect Dr. Whitmore and minimize the damage to their reputation. 2 weeks after she filed her complaint, Sarah was called to a meeting with hospital administrators. She walked into a conference room and found herself facing 5 people: the hospital's chief medical officer, the head of human resources, the legal counsel, a representative from the ethics board, and Margaret, her supervisor. They asked her to tell her story again from the beginning. Sarah did, calmly and clearly. She did not exaggerate. She did not need to. The truth was damning enough. When she finished, the chief medical officer, Dr. Robert Harrison, looked at her with an expression that was hard to read. "Miss Martinez," he said, "no one is questioning that you saved Marcus Thompson's life. That much is clear. But the way you handled the situation has raised concerns about your professional conduct." "What specifically concerns you?" Sarah asked. "You challenged a physician's medical judgment in front of a patient," Dr. Harrison said. "You created a confrontational situation that could have been handled more diplomatically." "There was no time for diplomacy," Sarah replied. "My patient was having a heart attack and was being sent home. Every minute mattered." "You could have requested a second opinion," the HR director suggested. "I did," Sarah said. "I documented my concerns and insisted on additional testing." "That's exactly what nurses are supposed to do." "But you did it in a way that undermined Dr. Whitmore's authority," Dr. Harrison said. Sarah looked at each of them. "Let me be very clear about something. I am not sorry for saving Marcus Thompson's life. I am not sorry for advocating for my patient, and I will not apologize for doing my job." The room was silent. Finally, the legal counsel spoke up. "Miss Martinez, we understand your position, but you must understand ours as well. Dr. Whitmore is threatening to sue the hospital if we take disciplinary action against him. He's claiming wrongful accusation and damage to his reputation. If this goes to court, it will be expensive and messy for everyone involved." "So you're asking me to drop my complaint to avoid a lawsuit?" Sarah said. "We're asking you to consider a compromise," the HR director said carefully. "Dr. Whitmore could agree to additional training. You could agree to a mediated conversation to resolve your differences. Everyone moves forward. No one's career is destroyed." Sarah shook her head. "A compromise suggests that both sides are equally at fault." "That's not true. Dr. Whitmore endangered a patient's life because of his racial bias. That's not something that can be compromised away." "We have a hospital to run," Dr. Harrison said, his voice hardening. "We have thousands of patients to serve. We can't afford the distraction of a prolonged investigation and possible lawsuit." "Then maybe you should have better oversight of your doctors," Sarah shot back. "Maybe you should take complaints seriously instead of trying to sweep them under the rug to protect your reputation." The meeting ended badly. Sarah left the conference room feeling like she had just made things worse for herself. But as she walked back to the emergency department, she held her head high. She had told the truth. She had stood her ground. And she would continue to fight no matter what it cost her. 3 weeks after Sarah filed her complaint, the hospital announced its decision. Sarah sat in Margaret's office, her hands clasped tightly in her lap. Margaret had called her in first thing in the morning. She looked tired and stressed. "The investigation is complete," Margaret said. "I wanted you to hear the results from me before the official announcement." Sarah's heart pounded. "What did they decide?" "Dr. Whitmore has been placed on administrative leave for 6 months," Margaret said. "During that time, he must complete mandatory bias training and sensitivity counseling. When he returns to work, he'll be under supervision. Another physician must review his treatment decisions for the first year. He's also been required to issue a formal written apology to Marcus Thompson." Sarah felt a rush of relief so strong it made her dizzy. They actually held him accountable. "The evidence was too strong to ignore," Margaret said. The recording, the other nurses who came forward, Marcus's complaint, and the clear documentation of what happened. The outside investigators concluded that Dr. Whitmore showed racial bias in his treatment of Marcus Thompson and failed to provide adequate care. "What about the other cases?" Sarah asked. The other patients that the nurses told me about? Those are being reviewed separately, Margaret said. The hospital is opening an investigation into Dr. Whitmore's treatment of minority patients over the past several years. If they find more evidence of bias or substandard care, there could be additional consequences. Sarah closed her eyes. This was more than she had hoped for. She had expected the hospital to protect Dr. Whitmore, to find some way to minimize what happened. Instead, they had actually taken her complaint seriously. "What about me?" Sarah asked. "Am I in trouble?" Margaret gave her a small smile. "Officially, you're receiving a letter of recognition from the nursing board for patient advocacy. You followed your training and your instincts to save a patient's life. The investigation found that your actions were appropriate and professional." "And unofficially?" Sarah asked, knowing there had to be more. Margaret's smile faded. "Unofficially, you've made some people uncomfortable. Some of the senior doctors are angry. They think you broke ranks, that you made them all look bad. You're going to face some hostility." "I can handle that," Sarah said, "as long as I still have my job." "You have your job," Margaret confirmed. "But Sarah, I want you to be prepared. Not everyone is happy about this outcome. Dr. Whitmore has supporters who think he's being treated unfairly. They're going to make things difficult for you." Over the next few weeks, Sarah learned exactly what Margaret meant. Some doctors barely spoke to her. When she tried to discuss patient care, they were curt and dismissive. A few nurses who were friends with Dr. Whitmore gave her cold stares in the hallway, but others supported her. Maria stood by her side always. The 3 nurses who had come forward with their own stories became her allies, and many of the younger nurses looked at her with respect and admiration. She had done what they wished they could do. She had spoken up and survived. Marcus Thompson was released from the hospital after 5 days. His recovery was going well. The stent had restored blood flow to his heart, and with medication and lifestyle changes, his prognosis was good. Before he left, he came to the emergency department to see Sarah. She was at the nurse's station when he walked in with Lisa. He looked so different from that first night. Then he had been pale and sweating, clutching his chest in pain. Now he was smiling, his color was good, and he moved with energy. "Sarah," he called out when he saw her. She walked over and hugged him carefully, mindful of his healing heart. "Marcus, you look wonderful. How are you feeling?" "Like a new man," he said. "The cardiologist says I'm doing great. I start cardiac rehabilitation next week. I'm going to take better care of myself from now on." "I'm so glad," Sarah said sincerely. Marcus's expression became serious. "I heard about the hospital's decision. Dr. Whitmore is being disciplined because of what happened to me." "Because of what he did," Sarah corrected. "This is about his actions, not about you." "I know," Marcus said. "But I also know that if you hadn't stood up, none of this would have happened. He would have continued treating patients the same way. More people would have been hurt." Lisa spoke up. "We wanted to thank you properly." She handed Sarah an envelope. "Oh, you don't have to," Sarah started to say. "It's not money," Lisa interrupted with a smile. "Just open it." Sarah opened the envelope and pulled out a card. Inside was a handwritten note from Marcus and a gift certificate to a bookstore. The note read, "Dear Sarah, thank you for seeing me. Thank you for believing me. Thank you for fighting for me. You reminded me that there are people in this world who care more about doing what's right than about what's easy. You are a hero. With deep gratitude, Marcus Thompson." Sarah felt tears in her eyes. "This is too much." "Really, I was just doing my job." "You were doing more than your job," Marcus insisted. "You were being the kind of person the world needs more of. The kind who stands up when it's hard. The kind who protects others even when it costs something." They talked for a few more minutes and then Marcus and Lisa left. Sarah watched them walk out of the emergency department together, Marcus's arm around his daughter's shoulders. Seeing them healthy and whole, knowing she had played a part in keeping them together made everything worth it. A few days later, Sarah received an email from the hospital's director of nursing. She was being invited to speak at the next hospital-wide training session on patient advocacy. The email explained that the hospital was implementing new protocols based on what had happened with Marcus Thompson. The new protocols included several important changes. First, whenever a nurse raised a concern about patient care, there would be a mandatory review by a second physician. No doctor could simply dismiss a nurse's concerns without getting another opinion. Second, The hospital was creating an anonymous reporting system for discriminatory behavior. Nurses and other staff could report incidents of bias without fear of retaliation. Third, all physicians would be required to complete annual training on implicit bias and cultural competency. Sarah was shocked. Real systemic change was happening because she had spoken up. It was not just about punishing Dr. Whitmore. It was about creating a better system that would protect future patients. 2 months after everything happened, Sarah was asked to speak at a nursing conference about patient advocacy. She stood in front of a room full of nurses from hospitals across the state and told Marcus Thompson's story. She talked about the importance of speaking up, even when it was scary. She talked about trusting your training and your instincts. She talked about remembering why they all became nurses in the first place. "We take an oath to do no harm," Sarah said to the assembled nurses. "But sometimes doing no harm means doing something hard. It means challenging authority. It means risking our careers. It means standing up for our patients even when everyone else is sitting down." The nurses gave her a standing ovation. Afterward, dozens of them came up to her with their own stories. Stories of times they had spoken up and times they had stayed silent. Stories of patients they had saved and patients they regretted not fighting harder for. Many of them cried as they talked. The weight of what they carried, the pressure of what they faced every day was enormous. Sarah listened to each one. She gave hugs. She offered encouragement. She exchanged contact information with nurses who wanted to create support networks in their own hospitals. She was building something bigger than just her own experience. She was part of a movement of nurses who were demanding to be heard and respected. Marcus Thompson started a tradition of visiting Sarah every few months. He would stop by the emergency department, always with a smile and usually with coffee or treats for the nurses. He told everyone who would listen about what Sarah had done for him. He became an advocate for patient rights and for addressing racial bias in healthcare. 6 months after his heart attack, Marcus was invited to speak at St. Mary's Hospital diversity training session. Sarah sat in the audience and listened as he told his story. He was eloquent and powerful, describing the fear and humiliation of not being believed, the relief of having Sarah advocate for him, and the importance of healthcare workers seeing patients as full human beings regardless of their race. "I could have died that night," Marcus said to the room full of doctors, nurses, and staff. "Not because of my heart condition alone, but because of assumptions and bias. Sarah Martinez saved my life not just with medical interventions, but by refusing to let prejudice determine my care. Every person in this room has the power to do the same. You have the power to see patients truly, to listen to them and to believe them. That power can mean the difference between life and death." When Dr. Whitmore returned to work after his 6-month suspension, things were different. He was quieter, more careful. Another physician reviewed all his cases, which meant he could not dismiss patients as easily as before. Some people whispered that he resented Sarah for what had happened. Others said the training and counseling had actually changed him, made him more aware of his biases. Sarah did not know which was true, and she tried not to care. She focused on her patients and on being the best nurse she could be. She continued to speak up when she saw problems. She supported other nurses who wanted to advocate for their patients. She had learned that her voice mattered, and she was not going to be silent again. One quiet night in the emergency department, about a year after everything happened, Sarah was sitting at the nurse's station when a young black woman came in with chest pain. Sarah immediately felt a sense of déjà vu. The woman was young, only 32, but she described symptoms that sounded concerning. The on-call doctor, a younger physician Sarah did not know well, looked at the EKG and shrugged. "Probably anxiety," he said. "She's too young for a heart attack." Sarah felt that familiar fire ignite in her chest. "She has a family history of early heart disease," Sarah pointed out, looking at the intake form. "Her father had a heart attack at 35. I think we should run cardiac enzymes." The doctor looked annoyed. "That's not necessary. It's just anxiety." Sarah took a breath. She thought about Marcus Thompson. She thought about all the patients who did not get believed. She thought about her oath and her purpose. "With respect, doctor, I'm documenting my recommendation that we run troponin levels," Sarah said firmly. "The patient is presenting with cardiac symptoms and a significant family history. We need to rule out acute coronary syndrome." The doctor stared at her for a moment. Then he seemed to remember something. "You're Sarah Martinez," he said. "Yes," Sarah confirmed. I heard about what happened last year, he said. His tone changed from annoyed to respectful. You saved that professor's life by insisting on the right tests. I did my job, Sarah said simply. The doctor nodded slowly. Okay, let's run the cardiac enzymes. Better safe than sorry. Sarah felt a wave of satisfaction. The story had spread. Other doctors had heard about what happened. They knew that Sarah Martinez was a nurse who would not back down when patient safety was at risk. The young woman's troponin levels came back slightly elevated. She was admitted to the hospital for further evaluation. It turned out she had a rare condition called spontaneous coronary artery dissection, a tear in a heart vessel that mostly affects young women. If Sarah had not pushed for the tests, if the woman had been sent home, she could have died. When Sarah checked on her the next day, the woman grabbed her hand. The doctor told me you insisted on the heart tests even though I'm young. Thank you for not giving up on me, Sarah smiled. That's what nurses do. We don't give up. Over time, Sarah's story became part of St. Mary's Hospital culture. New nurses learned about it during orientation. It became an example of what good nursing looked like, of the importance of patient advocacy, of the courage it took to speak truth to power. The incident also sparked broader changes beyond just St. Mary's. The State Nursing Board used Sarah's case as an example in their continuing education courses. Other hospitals implemented similar protocols about mandatory second opinions when nurses raised concerns. There was a growing recognition that nurses were not just doctors' helpers, but essential members of the healthcare team with valuable insights and expertise. Sarah never forgot that night with Marcus Thompson. She kept the thank you card he had given her in her locker at work. On hard days, when she felt tired or discouraged, she would read it and remember why her work mattered. She had learned something important through this experience. Change was possible. Standing up was possible. Speaking truth was possible. It was not easy. It was not comfortable. It sometimes cost something. But it was necessary. Every patient deserved to be seen, heard, and believed. Every patient deserved quality care regardless of their race, their background, or their education level. And every nurse had a responsibility to make sure that happened, even when it was difficult. Sarah had become a nurse to make a difference. She had wanted to help people, to save lives, to be there when people needed her most. That night with Marcus Thompson, she had done all of those things. She had stood at a crossroads and chosen the hard right over the easy wrong. And in doing so, she had not just saved one life. She had changed a system. She had inspired others. She had shown that one person with courage could make a real difference. As Sarah continued her work in the emergency department, she carried that knowledge with her. She was more than just a nurse taking vital signs and following orders. She was an advocate, a protector, a voice for those who were not being heard, and she would never stop fighting for her patients no matter what it cost. Because that was what it meant to be a nurse. That was what it meant to honor the oath she had taken. That was what it meant to truly care for the people who trusted her with their lives. Marcus Thompson had lived because she stood up. Other patients would live because of the changes that followed. And that made everything worth it. Sarah Martinez had found her purpose. She had found her voice. And she had learned that sometimes the most important thing a person can do is refuse to stay silent when silence would be easier. In the end, that was the real story. Not just about one nurse and one patient, but about the power of courage, the importance of advocacy, and the difference one person could make by simply doing what was right.